Imagine a hospital room in the late 1700s. There is no electricity, no anesthesia, no antiseptic. The air smells of sweat, metal, and fear. A woman is in labor, but something has gone terribly wrong. The baby cannot pass through the birth canal. Doctors and midwives know what this means. Without intervention, both mother and child could die. Today, doctors might perform a cesarean section in a sterile operating theater, but in the 18th century, surgery was crude, slow, and terrifyingly dangerous. So physicians relied on a brutal alternative. They needed a way to widen the birth canal by cutting bone. And for that, they invented a specialized surgical tool. It had teeth, it rotated in a loop, and it cut through bone faster than a knife. This instrument was not powered by gasoline or electricity. It was turned by hand. But the basic idea would be instantly recognizable today, because centuries later, a much larger and louder version of the same device would become famous for cutting something else entirely: wood. The chainsaw. The device that inspired the chainsaw was not large. In fact, it could fit in a doctor's hand. It looked more like a medical instrument than a machine. A small metal chain with sharp teeth wrapped around a guide frame. At one end, a handle allowed the surgeon to rotate the chain in a continuous loop. As the chain moved, the teeth shaved through bone. The tool was designed for a specific and extremely dangerous childbirth procedure called symphysiotomy, a surgery where doctors cut through the cartilage and sometimes bone of the pelvis to widen the birth canal. The goal was simple: create just enough space for the baby to pass through. Before this tool existed, surgeons used knives and saws to perform the procedure. These methods were slow, imprecise, and agonizing for the patient. Two Scottish doctors, John Aitken and James Jeffrey, introduced the chain-based surgical saw in the late 18th century. Their design allowed bone to be cut more quickly and, in theory, more safely. The chain rotated smoothly, reducing the need for heavy sawing motions. It was still brutal, but it was considered an improvement. The early chainsaw was never meant for trees. It was meant for bone. And for several decades, versions of this surgical chainsaw were used in operating rooms across Europe. To understand why such a terrifying instrument existed, you have to understand childbirth in the 18th century. It was one of the most dangerous experiences a woman could face. Modern medicine has made childbirth vastly safer, but before antibiotics, anesthesia, and sterile surgical environments, even routine deliveries carried enormous risks. When complications occurred, doctors had very few options. One of the most feared complications was obstructed labor. This happened when the baby could not pass through the mother's pelvis. Sometimes the baby was positioned incorrectly. Sometimes the pelvis itself was too narrow. Without intervention, labor could last for days. Both mother and child might die from exhaustion, infection, or internal injury. Surgeons faced terrible choices. Cesarean sections existed, but before modern medicine, they were extremely dangerous. In many cases, doctors believed a cesarean would almost certainly kill the mother. So some physicians turned to symphysiotomy, cutting the joint at the front of the pelvis to widen the birth canal just enough for the baby to pass through. It was desperate medicine. And because bone and cartilage were involved, surgeons needed a tool capable of cutting through them quickly. That need is what gave birth to the chainsaw, not in a forest, but in a surgical theater. The early surgical chainsaw did not roar. It did not throw wood chips, and it certainly did not resemble the loud gasoline machines we know today. Instead, it was quiet, small, and unsettlingly delicate. The instrument consisted of a flexible metal chain lined with tiny cutting teeth. This chain ran around a narrow guide frame, forming a loop. At one end of the tool, the surgeon turned a small handle which caused the chain to rotate continuously around the frame. As the chain moved, the teeth shaved through bone. Compared to the heavy handsaws surgeons previously used, this design offered one major advantage: speed. The rotating chain cut more smoothly and required less forceful motion. In theory, this reduced trauma to surrounding tissue. But the procedure itself was still brutal. Remember, this was long before modern anesthesia. Patients were often conscious, restrained, and enduring unimaginable pain while surgeons worked as quickly as possible. Medical instruments from the time were also rarely sterile, which meant infection was a constant threat. The chainsaw was not meant to be cruel. It was an attempt to make an already horrifying procedure faster. Yet even within the medical community, these surgeries were controversial. And over time, medicine began searching for safer alternatives. By the early 19th century, medicine began to change. New surgical techniques were emerging. Doctors were slowly gaining a better understanding of anatomy, infection, and obstetrics. More importantly, the development of safer cesarean procedures began offering an alternative to the brutal pelvic surgeries that had required tools like the chainsaw. Symphysiotomy gradually fell out of favor in many parts of Europe. The surgical chainsaw didn't disappear immediately, but its role became smaller and smaller. Some versions of the instrument were still used in orthopedic surgeries, where bones sometimes needed to be cut in tight spaces. But medicine was evolving. In the mid to late 1800s, two breakthroughs dramatically changed surgery forever. Anesthesia, which allowed patients to undergo operations without unbearable pain, and antiseptic techniques, which reduced deadly infections. These advances transformed operating rooms from desperate environments into more controlled surgical spaces. And with safer procedures available, the small hand-cranked chainsaw slowly faded into medical history. But the idea behind it, a rotating chain with cutting teeth, did not vanish. Instead, engineers in a completely different field would eventually adopt the concept for a new purpose, one that had nothing to do with surgery: cutting wood. By the late 19th and early 20th centuries, engineers began experimenting with new ways to cut timber more efficiently. Traditional logging relied on large handsaws operated by two people. The work was slow, exhausting, and dangerous. Inventors were searching for mechanical solutions. Some of them turned to an idea that had quietly existed for a century: a moving chain lined with cutting teeth. In the early 1900s, engineers adapted the concept into larger machines designed specifically for forestry. These early chainsaws were massive devices, sometimes requiring two people to operate. They were heavy, loud, and powerful, but they worked. Over time, gasoline engines replaced hand cranks. Machines became smaller, faster, and far more efficient. By the mid-20th century, the chainsaw had become one of the most recognizable tools in logging and construction. The medical origins of the design faded into obscurity. Today, when people hear the word chainsaw, they imagine lumberjacks, construction sites, or horror movies. Almost no one thinks of the operating rooms where the idea first appeared. Yet, hidden inside every chainsaw is a strange piece of medical history, a design that was once meant to cut bone, long before it was ever used to cut trees.